Hello, everyone. I'm Anas Al Ubaidi, and the title or the topic for this session is Advanced Cardiology Documentation Standards and Templates, and it's a session or lecture within Chapter 28 of Review of Cardiology and Pulmonary Scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Advanced cardiology documentation standards and templates represent critical components in the realm of medical scribing, particularly in the highly specialized field of cardiology, as effective documentation plays a pivotal role in ensuring patient safety, maintaining legal compliance, and facilitating accurate and efficient treatment plans. Given the complexity and high stakes of cardiology cases, from managing chronic conditions like hypertension and heart failure to addressing acute emergencies such as MI, myocardial infarctions, the importance of precise, structured documentation cannot be overstated. For advanced medical scribes, mastering these standards is not only a professional necessity but also a way to significantly contribute to the overall quality of care delivered to patients. Cardiology related documentation requires a deep understanding of the intricate interplay between various cardiovascular conditions and their systemic effects. A patient's medical history, often laden with details like prior heart surgeries, stent placements, or chronic diseases like diabetes, is essential in building a comprehensive clinical picture. Accurate documentation of this history is fundamentally important for guiding current diagnoses and shaping future treatment decisions. Furthermore, cardiology often involves regular diagnostic testing such as echocardiograms, electrocardiograms, ECGs or EKGs, stress tests, and imaging studies, each yielding vital data that must be meticulously recorded, formatted, and made accessible to the care team. Missteps in this area can lead to misinterpretations, delayed treatments, or even catastrophic outcomes. One distinguishing feature of cardiology is its inherently multidisciplinary nature. Cardiologists regularly collaborate with primary care providers, oncologists, pulmonologists, endocrinologists, and even critical care specialists to manage overlapping conditions. This interconnection mandates documentation that is not just accurate but also coherent, accessible, and structured to support effective communication between diverse teams. For example, a scribe documenting the findings of a stress test in a cardiac oncology patient must ensure clarity for both the cardiologist and oncologist, emphasizing points that impact shared decision making processes. Another pressing challenge in cardiology documentation is the importance of real time recording in acute care settings. Cardiovascular events are often emergent by nature, requiring immediate action and notes that reflect real time clinical judgment and interventions. During incidents like arrhythmias, cardiogenic shock, or acute coronary syndromes, scribes must capture critical information, including patient symptoms, vital trends, procedural details, and medical management accurately while under pressure. Doing so not only reinforces comprehensive care but also ensures medical legal defensibility in retrospective reviews. Equally significant is the standardization of templates used in cardiology documentation, which improve efficiency while reducing errors, from templates specific to heart failure management to those tailored for post cardiac procedure follow ups. These tools provide scribes with pre structured formats to deliver concise, organized, and complete charting. For instance, detailed templates standardize components like medication summaries for anticoagulants or beta blockers, ensuring consistency that fast tracks decision making or facilitates smooth transitions of care. Advanced medical scribes must also excel in coding and compliance within Cardiology, proper use of diagnostic codes such as those for coronary artery disease or atrial fibrillation, AFib, and procedural codes including angioplasty or pacemaker placements is pivotal for accurate billing and preventing costly claim denials. Legal compliance, particularly in documentation governed by HIPAA regulations, is equally critical in such a data-intensive field, particularly when sharing sensitive results like genetic predisposition, tests for familial hypercholesterolemia. Lastly, cardiology documentation heavily influences continuity of care, especially for patients managing chronic cardiovascular conditions. Progress notes emphasizing changes in symptoms, recent diagnostic outcomes, or therapeutic adjustments ensure that providers treating the patient across multiple visits have a cohesive understanding of their cardiovascular health trajectory. Such ongoing clear documentation contributes immensely to positive patient outcomes such as controlled blood pressure, reduced hospital readmissions, and improved quality of life. Key points: comprehensive history taking in cardiology. History taking is critical in cardiology documentation, as every detail about the patient's past and present health can influence treatment decisions and outcomes. Cardiovascular history key areas includes previous diagnoses such as myocardial infarction, MI, arrhythmias, valve diseases, or cardiomyopathies, along with significant events like prior stent placements or bypass surgeries. Example: patient presents with a history of STEMI, STM, STEMI, which is short for ST elevation MI myocardial infarction. In 2015, underwent PCI with a stent placement in LAD, currently on dual antiplatelet therapy. A relevance here provides foundational context for current symptoms or complaints, enabling providers to anticipate complications or adjust therapy. And here is a summarized diagram summarizing the impact of history taking in cardiology. Family and social history focus here records hereditary cardiovascular conditions, for example, familial hypercholesterolemia, and lifestyle factors like smoking, alcohol use, or stress levels. Example: family history is significant for premature CAD, coronary artery disease, and father reports smoking one pack a day for 15 years. Effect here identifies modifiable risk factors and genetic predispositions that require proactive care strategies. Symptom documentation importance here details current cardiac symptoms such as chest pain, dyspnea, or edema, requires clarity in timeliness, triggers, and severity ratings. Example: reports substernal chest pain radiating to left arm, 8 over 10 intensity, worsened with exertion and relieved by rest. Significance here guides diagnostic workups like ECGs or EKGs or stress testing. And here is a diagram analyzing cardiac symptom causes. Documentation standards. Well organized and standardized documentation is crucial for accuracy and efficiency in cardiology charting. We'll start with the SOAP format utilization structure. Here starts with subjective complaints, followed by objective findings and an assessment, and then a plan. Example here: subjective reports worsening dyspnea and orthopnea over the past 2 weeks. Objective here: blood pressure 140 over 90 mmHg, elevated JVP by basilar crackles. Assessment here: left-sided heart failure, plan initiation of a diuretic and ACE inhibitor, echocardiogram ordered. Benefit here: offers clarity for providers reviewing the record and ensures thorough yet concise documentation. Timely updates principle here: documentation should happen in real time or soon after patient interactions to maintain accuracy and accountability. Example here: during a heart attack code, Scribes note at 3 p.m., patient reported chest pain onset, thrombolytics were administered by 3:20 3:20 p.m. and PCI initiated at 3:45 p.m. The impact here, real-time data, is critical for acute care, post-event reviews, and legal compliance. Coding expertise, ICD-10 CPT familiarity, accurate coding correlates diagnoses and treatments to billing while meeting compliance standards. Example here, ICD-10 I-25 or 125.10, CAD without angina, CPT 92928 coronary um, stent placement. Outcome here prevents claim denials and ensures clinics maximize reimbursements. Outcome here prevents claim denials and ensures clinics maximize reimbursement or reimbursements. Handling sensitive information, managing patient data ethically and legally enhances trust and safeguards institutions from legal challenges in cardiology scribing. We'll start with the privacy under HIPAA standards. Requirement here protect patient confidentiality with secure data storage and controlled data sharing. Example, cardiogenetic test results for familial arrhythmias shared only with authorized personnel. Benefit here avoids breaches that damage both patient trust and facility reputation. Impartial documentation approach here record facts objectively, particularly when dealing with difficult conversations, avoid personal judgments or speculations. Example, right patient declined beta blockers, citing concerns over fatigue based on prior usage, rather than expressing opinions on patient decision making. Significance here communicates respect for patient autonomy, consent, and disclosure. Focus here ensure informed consent is documented for invasive procedures like angiograms or device implantation. Example, explained risks and benefits of ICD placement, patient consent documented at 2 p.m. Outcome here protects against legal liabilities. Supporting multidisciplinary care. Given the systemic impacts of cardiovascular conditions, a multidisciplinary approach often becomes essential, requiring seamless documentation. We'll start with the cross-team communication. Here, role scribes ensure clear, concise documentation of recommendations from consulting specialists. Example, consulted endocrinology for management of uncontrolled diabetes contributing to worsening congestive heart failure, CHF. Importance here aligns care plans and ensures efficient team collaboration. Number two, integration of diagnostic data. Best practice incorporate inputs from imaging studies, lab results, and other diagnostics into the patient's chart. Example, echo shows EF ejection fraction of 35%, moderate MR BNP 450 PG over mil elevated. Value here facilitates analysis and planning by all providers involved. Post-acute care coordination focus here track transitions between acute and chronic care settings, detailed follow-ups, and prescribed medication regimens. Example, discharged on carvedilol and aldosterone antagonist, cardiology follow-up in 1 week arranged. Impact here maintains continuity of care, minimizing the risk of hospital readmissions. Advanced use of cardiology templates here. Templates provide structured, efficient documentation processes tailored specifically to cardiology cases. We'll start with diagnostic templates. Utility of standardized results for ECGs, Holter monitors, and echocardiograms. Example, 12 lead ECG performed, sinus bradycardia, QTC 480 milliseconds, or MS, follow-up Holter monitor orders. Outcome here accelerates conclusions while minimizing errors in interpretation. Treatment protocols focus here structured fields for heart failure, HF, medications like ARNI, ARNI therapy or anticoagulants. Example, initiate Entresto, starting dose 49 over 51 mg BID, milligram BID, labs for renal function set in 2 weeks. Advantage ensures adherence to clinical guidelines. Progress monitoring. Goal here templates designed for documenting serial measurements in chronic conditions such as heart failure. Example baseline ejection fraction at 30%, now improved to ejection fraction 45% post therapy. Repeat echo performed 3 March 2024. Provides Effect here provides measurable data to assess the success of interventions. Summary tables here we have table on key components of cardiovascular history taking, component description, example, importance, risks if omitted. Components we have past cardiac events, current symptoms, risk factors, family history, social and lifestyle factors. Table on documentation standards in cardiology, standard description, example, benefit, risks if ignored. Standards we have SOAP note framework, diagnostic test results, precision and timing, coding accuracy, compliance with HIPAA. We have here table on handling sensitive cardiovascular patient information, sensitive aspect, description, example, importance, risk of neglect. Sensitive aspects, we have genetic testing data, objective versus empathy balance, and clear consent records. Table on handling sensitive cardiovascular patient information, sensitive aspect, description, example, importance, risk of neglect. Sensitive aspects, here we have differential sensitivity, abuse, or mental health flagging. Table on advanced monitoring and diagnostic coordination, diagnostic process, description slash scope, example, relevance, issue if improperly documented. Diagnostic processes, echocardiograms, stress testing, cardiac catheterization, event monitoring data, BNP or troponins. Table on supporting multidisciplinary care coordination, scenario, collaborating teams, example, documentation focused patient care benefits. Scenarios we have acute coronary syndrome, cardiac oncology case, heart failure with comorbidities, pre surgical evaluations, rehab slash PT follow ups. Then we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. Which detail is essential when documenting a patient's cardiovascular history? A. The patient's preferred method of communication. B. The number of medication the patient takes regardless of purpose. C. Information about past cardiac events such as an MI, myocardial infarction, or CABG, CABG. D, a general impression of the patient's physical fitness. Will be C, the answer information about the past cardiac events, as a comprehensive cardiovascular history must include prior cardiac events, as this information is critical for accurate diagnosis and tailoring treatment plans. Question 2. What is the primary role of ICD-10, CPT, and CPT codes for cardiology documentation? A. To reduce the need for detailed subnotes. B. To facilitate accurate billing and legal compliance. C. To offer recommendations for lifestyle changes. Or D. To create a record of patients' emotional state during visits. It is B. To facilitate accurate billing and legal compliance, as proper ICD-10 and CPT coding ensures diagnoses and procedures are recorded systematically, allowing for correct billing and adherence to legal documentation standards. Question 3. Which practice aligns with HIPAA standards for handling sensitive cardiovascular patient data? Is it A. Sharing genetic test results freely with the entire care team regardless of role? B. Applying vague terminology to avoid documenting sensitive issues? Or C. Restricting access to electronic health records based on personal rules? Or D. Avoiding documentation of declined procedures? It is C. Restricting access, as ensuring only authorized personnel have access to sensitive patient data protects privacy and adheres to HIPAA regulations. Question 4. Why is multidisciplinary documentation important in cardiology? A. It replaces the need for specialist consultations. B. It allows for independent decisions by each specialist without coordination. C. It ensures seamless communication between cardiologists, nephrologists, and other teams. Or D, it reduces the amount of data entry required by prioritizing select cases. It is C, it ensures seamless communication, as multidisciplinary documentation fosters a collaborative care and prevents miscommunication, enabling better patient outcomes across multiple specializations. Question 5. What is critical to include when documenting diagnostic results in cardiology? A focus on non-cardiac systems or unrelated to the diagnosis. B. Generalized descriptions to limit the length of documentation. C. Specific findings such as EF, ejection fraction percentage, or artery blockage severity, or the vague or vague details to allow flexibility in treatment approaches. It is C, as diagnostic results should be precise and detailed, as this information directly informs treatment decisions and tracks disease progress and tracks disease progression. And here we come to end of this lecture. Thank you very much and goodbye.